Good morning, everyone. Hope everyone's doing well on this rainy, what day is it? Tuesday, Wednesday, Thursday, Friday, Saturday? Can't tell. Can everyone see me? Can everyone hear me?
We just can't see your screen, but we can see you and hear you.
Okay, I'm going to go ahead and start my screen here. Let me know if you can see the screen now.
Yep, we're good to go.
All right. Other than me getting a note saying my internet connection is unstable, I think I'm good to go. So if it cuts in and out, just let me know, and I can absolutely repeat myself, and then we'll go from there. But thank you everyone for logging on. I think we have what 200 plus people on here. It's great to be talking to you guys. It's great to be sharing our passion in terms of what we do. Just for everyone that may or may not know me, my name is Agnihotri. I'm a doctor here at Virginia Oral Facial Surgery. My cosmetic passion is exactly that. It is my passion, and we're on the internet. Our website is agnihotricosmeticsurgery.com, acscosmetic.com. If you wanted to tag us, VOFS PJ Pics, ACS Cosmetic on Instagram. We are giving away that hydrofacial. For anyone that doesn't know what a hydrofacial is, it is one of the best things that you can do for your face. I've had it done plenty of times. That's why and I keep coming back for more. And if you ask my wife, she wants to come in at absolutely every cancellation that we have. The staff here all love it. I've been offering it since last year, and it works phenomenally well. It's great for just a great skincare experience. So just a little more information about myself. Yeah, I'm a dually trained oral maxillofacial surgeon, practice full scope oral maxillofacial surgery here in Richmond. Been here for 10 years with the group. I mean, these are my guys, these are my boys. We have a great team here. We have a great practice. We have, gosh, 7 locations, 11 doctors, and we really appreciate all of your support, all of the patients that we see. I mean, we're so honored to be able to take care of everyone here. And just to talk a little bit about my talk here this morning, I'm talking about form and function and the just putting it all together. And you know, we see cosmetic patients for in the dental community. We see cosmetic patients for crowns and bridges and veneers and all sorts of things. And the craziest thing is that we'll see someone who's 65 years old and they have beautiful teeth and they have a beautiful smile, but the rest of the picture is what needs to be completed, and that's what we can help out with in terms of everything from the clavicles up, the eyelids, the forehead, the brows, the lips, the cheeks, the nose. We do it all here, and we have a great team. We have a great staff. We have a new location coming up in Short Pump. I know that's on hold temporarily, but we're going to get things back and rolling real soon. I know all of us are itching to do that, and it's going to be a great summer, and I think it's going to be a great rest of 2020. It's got to be a great rest of 2020. So just to talk about form and function, right? So form and function is one. They're connected. They work well together. You know, if something looks good, it works well, and we know this instinctively. We know this from an evolutionary standpoint. Talk about form and function. I mean, someone who looks good, like my wife, you know that she's gonna cook well and be a great mom, and she's gonna do all the things that works in terms of form and function. And this is just a little shout out to her. We all have you know, special people in our lives. My cosmetic stuff here, you know, I'm part of the American College of Surgeons and the American Academy of Cosmetic Surgery. And now, whether we're talking about patient goals for an apico, whether we're talking about goals for crowns, bridges, veneers, etc., We want, we know what patients want. We know that they want to look better, they want to feel better, they want to regain their sense of smile, their sense of youth and self-confidence. There can be some potential issues. There's issues that you can have as a teenager. You can see this young girl, she's 17. She has chronic nasal obstruction, which is, if not treated, it can turn into obstructive sleep apnea. She has a vertical maxillary excess with a retrusive mandible. So she has a jaw deformity, and this will lead to premature facial aging. She's a mouth breather. This will lead to dental deterioration, periodontal disease, etc. So you can sit on it, but you can't sit on it too long. This is my son when he was 3 and learning how to go to the bathroom, and I told him, don't sit there too long. You gotta go or get off. Now, the goals of any cosmetic facial procedures, you want to restore, you want to rejuvenate, you want to enhance. That's my youngest daughter. You can see that she has her nose, and all of those things translate as you get older. So the things that we want to do, we want to restore, we want to rejuvenate, we want to enhance. Now, we don't want to take a 21-year-old and make them look like they're 6. You want to take a 21-year-old and make them look 21. Yes, honey, I'm not going to give out your age there. So someone who has facial aging, if they don't have a proportionate facial skeleton, if they have an unfavorable facial skeleton, you're going to have premature facial aging. This happens time and time again, and it's not going to respond favorably to classic rejuvenation procedures. So enhancing and creating volume is very, very important, and there's different ways to do this. Pulling the skin excessively tight over a disproportionate skeleton is going to make the facial deformity worse. It's not a characteristic of the youthful or attractive face. So you don't want to just pull that skin tight. We have to recreate volume. So whether there's a mid-facial deficiency and we have to recreate volume with cheek implants, if there's a mid-facial deformity with a malocclusion and they're class 3 skeletal deficient and mandibular excess, then maybe doing a Lefort procedure is the right thing. So diagnosing the skeletal anatomy is important to be able to getting good and attractive results. This is an example of a lady who's in her early 50s. Retrusive mandible, she has a small chin, she has a lip curl that she wasn't happy about, her eyelids are a little sagging, and there's different options here. So what are our options? We could just look at her face, we could just look at her skeletal anatomy, we could look at everything. And if you look at her teeth, she has some dental deterioration. And when you put it all together, you have to take a look at her skeletal deficiency, the relative class 2, the small chin. Can everyone hear me okay?
Yeah, Neil, you're just breaking up occasionally.
Okay.
So if you, I don't know, Bill seemed to have a better connection where he was sitting next to you. So if you want to move over there or hook
Maybe
up to
I'll
an Ethernet, if you want to hook up to an Ethernet cable, it might be better. Let's take just a 2-minute pause, and we'll restart here in just a minute.
All right. Can everyone hear me better now?
Yeah, I can hear you now.
All right. Is everyone able to see the screen now?
Yep.
All right. So back to our young gal here. So you can see that she has the stigmata of dental disease. She's lost some teeth in the back. She has a relatively class 2 mandible. She has a small chin. And now she also, when you ask her about her breathing issues, she has some uh, snoring. She doesn't have sleep apnea, but she snores and has a little bit of daytime tiredness and just kind of the associated issues that you see with someone with a mandibular deficiency. So what are our options? What could we do? We could do a facelift. We could do just some implants there. We could do crown and bridge. You could do a chin implant. So depending on your specialty, if you ask a plastic surgeon, if you ask an ENT, if you ask someone who doesn't have a familiarity with the skeletal component, they're going to limit their treatment. Now, would she look better? Sure. Would she feel better? Based on the cosmetic improvement, yeah, but from a functional standpoint, no, she's not going to get better. From a global standpoint of looking at the skeletal and the aesthetic components, any of those treatments would be limited. So what did we do for her? Looking at the lower third of her face, we looked at doing a mandibular advancement. We looked at doing a genioplasty. We did not have to do a chin implant. We did not have to do a facelift on her. We enhanced and volumized her facial skeleton based off of her mandibular deficiency. So a mandibular advancement, vertical lengthening genioplasty, is what we did for her, and it completely changed the shape of her face. It changed her function, improved her form at the same time. If you look at her profile, she no longer has that retrusive mandibular profile. She no longer has that relatively convex facial profile. If you look at her chin, neck, throat anatomy, functional at the same time. And this is just her on a frontal view. Now, yes, we did talk about skincare. We did do her eyelids. We did do a minor laser procedure to help rebalance and tighten her skin. We worked with our prosthetic and dental colleagues to be able to work on her implants and her veneers. So kind of completing the picture is what we did for her. And it worked out very well. We did her eyes, we did her skin. She was quite happy with everything. So a global approach is what we did for her. And we took her from one to another and leaving all the politics out of it. But we got folks happy. Speaking of President Clinton, he's had some stuff done. And whether you think it looks overdone or underdone or just about right, I mean, it's surgery should whisper, it should not scream, and it should be not noticeable. So now there's functional things that we look at. Nasal breathing, improvement in underlying obstructive sleep apnea, improved speech and articulation, improved dental occlusion. And this is an example of how we do things. We use virtual surgical planning, at least when it comes to doing orthognathic type procedures in conjunction with cosmetic procedures. So we look at someone's skeletal and dental anatomy, work with an orthodontist, and come up with a surgical plan. And this works phenomenally well. This is a young lady who had some joint disease. She had juvenile rheumatoid arthritis, which had stabilized, but she had significant joint disease. She needed to have orthodontic treatment. So she was treated with pre-surgical orthodontics. She was treated with pre-surgical Botox therapy for her masseters, which we've found works phenomenally well for folks who clench and grind and brux. And 95% of our patients who are implant patients, they clench and grind and brux. And that's how folks lose teeth nowadays. It's less from Skittles and 7-Up. It's more from chronic stress and medications and dry mouth. And you know, folks who clench and grind and brux their teeth, they are great candidates for Botox. And we'll get more into Botox and where it's indicated and where it's designed. This is another example of someone who had significant premature aging. She had facial asymmetry. She had obstructive sleep apnea. She had breathing issues. She was treated with maxillary Lefort procedure. She had a mandibular procedure. She had a chin procedure. We also did her septum, did it all at the same time. And this was her after her surgery. She had beautiful result and lifelong results. So addressing the facial skeleton, my 3 go-to procedures for this facial skeleton: a Lefort osteotomy, sagittal split advancement, and a genioplasty. And we do this in various combinations to be able to volumize and enhance. So you can see this is my daughter on the left side, and this is her great-grandmother. And you can see there's been some facial changes. There's depletion of volume, and that's what promotes facial aging. So if you want to recreate the volume in the right areas. So a youthful appearance typically has a V shape, and an aged face typically has that inverted V shape. So how can we do this? If we're not looking at the facial skeleton, we can do fat transfer, we can do filler injections, we can do facial implants like cheeks and chins and angles. So you really want, you know, to quote Meghan Trainor, you want all the right junk in all the right places. You want to put fat where it's supposed to be, where it's been volume depleted. Gotta love Kim. You know, fat is where it's at, and she is right in certain areas. Facial implants, they work very well. So folks that are have some chin deficiency or cheek deficiencies, but they're not candidates for an orthognathic procedure or a skeletal issue, or they decide that they don't want to undergo that, they're great candidates for this. And this is an example of someone who needed some angle implants and a chin implant. So she did phenomenally well. You can see that it changed the shape of her face. It gave her better balance. It gave her better harmony. Lip enhancement. So you can see just her upper lip. She just wanted a little bit of a pop, and that's what she got. She got some filler there, and filler in our practice, we do a lot of filler patients who want to get their lips done, and we actually turn away a lot of folks who want to get their lips overdone, and that seems to be a popular thing nowadays. But you know, the right balance is what we're looking for. So we want balance, we want refine, we want subtle results. This is someone who had some filler in the nasolabial folds. She had some premature aging there, and she just wanted to have a little, very well. And filler is great. It lasts 6 to 12 months in most patients, and it's also reversible. So if you absolutely don't like it, we can reverse it without too much harsh side effects, and it works well. But thankfully, we don't have to reverse you know, very many people at all. In fact, we'll see some folks who get filler in other offices, not ours, and we'll reverse them and treat them appropriately. This is someone who got some cheek filler and some filler under her eyes, and you can see it just helped to rebalance and kind of smooth things out there a little bit. Someday she'll want to get her eyelids done, but she just wasn't ready yet. So folks will wonder, you know, they'll come and see me, they'll want some Botox, and Botox is kind of like a catch-all phrase for everything. And really, you know, my job and our job here is to explain and kind of clarify, well, Botox is good for easing forehead lines, and it's good for crow's feet, but it's not good for plumping the lips. It's not good for reshaping the jowls. That's where filler is really indicated. So the upper third of the face is really good for Botox. The lower third of the face or the middle of the face is really good for filler. And we do this in different combinations. So folks will say, Doc, can I get some Botox? Well, you really need some filler, or you really need jaw surgery. So it's really our job to clarify and our job to explain, and at the end of the day, help patients make an informed decision. This is an example of what Botox can do. So it takes someone who has glabellar lines or forehead lines and wrinkles, and it helps to smooth things out, and it works really, really well. And this typically lasts for about 3 months, and then at about 3 months, they come back and we do it again. Typically, we use very small doses. We've gotten away from over-treating to almost under-treating. Most people want to be able to smile and animate, raise their brows, and it just does a great job of ironing out some of these wrinkles here. So there have been studies done, and the average Botox patient looks 5 to 7 years younger. So do we want to treat a 21-year-old? Do we want to treat a 15-year-old? No. This is my daughter. Could she get filler? Sure. Could she get Botox? Sure. But there's kind of a balance there. And, you know, we want to seek that balance and always do the right thing. So looking at the proportions of the face, you know, we look at the nose and the chin, and the chin is just as important as the nose and the cheeks. And these three areas are very popular in our practice: nasal surgery, chin surgery, and cheeks. So if you look at the chin, it's a key link between the face and the neck. And if you don't have a chin that's in an ideal position, it's going to make the neckline look more redundant and obtuse. This is an example of someone who did not have a chin that was really well balanced. She needed upper jaw surgery, she needed lower jaw surgery, and chin surgery, and it really changed the shape of her face. We also treated her mole, and she was better balanced, she had better harmony, she had less facial pain. Just everything got significantly better for her. She was a flight attendant who came to see me from South Carolina, and you know, we check in periodically with her. I mean, we've stayed friends on Facebook, et cetera, and she says that she would not have done anything differently. She's so glad she had this done. It's changed her life. So you can have lack of chin projection, you can have excess chin projection, and there's different reasons you can have facial disharmony. If it's too small, you know it. If it's too big, you know it. If it's asymmetric, you also know it. So what's better, genioplasty, a chin implant? Well, it depends. You can have a situation like this where if you have a lip eversion, doing a chin implant typically will make the patient look worse. Is typically the right thing to do in this situation. In this situation, doing a genioplasty is again the right thing to do because it'll lengthen the chin, it'll advance the chin, whereas a chin implant will not be able to do that. Again, same situation. Angle implants and a chin implant is not the right move. A genioplasty is the right move. This is an example of a patient who had a pretty good occlusion, but you can see she has significant facial asymmetry, and she actually had a lot of pain with her masseters, with her TM joints. So correcting the facial asymmetry is what we needed to do for her. And then afterwards, she was able to function better. She was able to breathe better. She had better facial balance. She had better chin, neck, and soft tissue rejuvenation. And she was better overall with everything. And she was quite happy. So just a quote, you know, if you have an overbite with a weak chin, you tend to have a larger nose to even things out. And so in our practice, we do a lot of combination nasal and chin surgery. You can see it just balances things out. Again, someone who had chin and nasal surgery. This was someone who had significant facial asymmetry, and Natalie actually told me, gosh, I didn't realize how asymmetric I was. But she had a lot of pain. She had a lot of discomfort. She wasn't able to breathe well through her nose. She got worked up. We wanted to make sure her joints are healthy, and she did not have any more mandibular growth. So we did something called a bone scan, and the bone scan made sure that she didn't have active condylar issues. So she got into braces. We did her upper jaw surgery, we did her lower jaw surgery, we did her chin, we did her nose, we did it all at the same time. And she did phenomenally well. We did her surgery around Thanksgiving time a few years ago. And then she got married in around Memorial Day after that. And she had a phenomenal result. She's quite happy with everything. And again, looking at the facial the skeleton was the key to be able to balance everything out. This is another young man who needed a similar procedure, and we're able to do it all at the same time. Sometimes we just work on the nose. So if you look at Michael here, he was not happy with his bulbous tip, and we were able to rebalance that. We also did his chin, and it worked out very well. So how do we treatment plan all this stuff? We use virtual surgical planning. So we do a CT scan, and it helps us to diagnose and visualize the joints in 3 dimensions, visualize the facial skeleton in 3 dimensions, and we can also simulate surgery. And we take these custom cutting guides, we take them to the operating room and use them. And it takes, you know, it takes 2 left side of your screen, you'll see a simulation. On the right side, you'll see the actual patient. And this is her after her surgery. So you can see her, that was her before, and that's her after. And she was unhappy with her facial asymmetry, and thankfully we were able to correct it. You can see that her underbite has been corrected, her maxillary, her mid now we've started doing, we've had about a dozen patients who we've done combined surgeries on. So mandibular advancements, genioplasties, as well as short scar facelift. And we've started combining these procedures in folks who are in their 40s and 50s to tighten the skin, as well as enhance and volumize the facial skeleton. And but we've had about a dozen patients who've done really well, and at some point we'll publish these results because they've worked out phenomenally well for these patients. And again, these are long-lasting results, and long-lasting means it lasts the rest of your life. So you can see better balance, better harmony, better breathing. And that's a picture of my family. Got our son who's 12. He's our soccer star. I got my daughter who's 8. She's into soccer as well, just like her brother, and she swims. And my youngest, who's 6, she's our ballerina. And can't forget about Mr. Teddy there. And that's all I got for you, folks. Thank you all for hopping on. I hope you tagged us. And looking forward to seeing you in the office soon for a hydrofacial. Thanks, everyone.
Thanks, Neil. Great lecture. Got a couple questions here that are queued up. One question is, what is the post-op recovery time for chin/malar implants? And then the follow-up question to that is, how long is the healing period? Can we do restorative dentistry and ortho?
So for a chin/malar implant, typically the initial recovery is 2 weeks, but it will take several more weeks to be able to do restorative type procedures. So we'll tell folks that it can take 6 weeks to be able to get back to those other types of procedures.
And another question, how long do fillers typically last?
It's a good question, and it depends on the area. If you are doing cheek filler, so again, trying to get some better volume in the cheeks, it can last up to 18 months. We use something called Voluma, which has been FDA approved to last up to 18 months. I've found that it depends on the area. So cheek filler can last, 12 to 18 months. If it's in the perioral area, the lip area, it can be as short as 3 to 4 months, but it can last 9 to 12 months. And I'm very careful in the lips because you don't want to overdo it. You also don't want to underdo it. But when we use Voluma or Juvederm, I find that the results in the lips typically last 6 to 9 months.
Perfect. Is there an ideal age to treat these patients is one of the questions.
So if we're looking at orthognathic surgery, typically I would like to see them, when they're in their late teens, when they're done, close to being done growing, 15, 16, 17. We work with all the awesome orthodontists in town and out of town for that matter. So that's the ideal age for the orthognathic patient, because we're literally changing their lives in terms of being able to improve their function, improve their balance with their facial aesthetics, and doing that all at the same time. So that's a lifelong thing. So that's the ideal age for those patients. And then, for other folks, it varies. So if we're looking for cosmetic enhancements like Botox and filler, that can be, in your in your 20s or early 30s, before you've had a lot of facial aging. And, if you're looking at more surgical type procedures for rejuvenating the face, facelifts, etc., folks in their 50s and 60s is probably the ideal age range there.
Two related questions. One of them is, would you mind elaborating a little on Botox for bruxism? And the other related question from another attendee is, are there any longer lasting Botox products available for the clenchers and grinders?
Both good questions. So typically my protocol for Botox for clenching and grinding will use 25 units of Botox per masseter and expect it to last for approximately 3 to 4 months. So I'll have them come back in 12 weeks. We'll do another round of injections and plan for about 3 sets of injections spaced about 3 months apart. And there's been some initial studies that have looked at how long that lasts. And they're saying that using this protocol, three sets of injections, 3 months apart, can last up to 4 to 5 years in a lot of folks. There was a big study that was done that was just published actually out of India last year that looked at several hundred patients, and they found that those results can last for 4 to 5 years. Now, not just changing the pain scale and improving pain, it'll help to rebalance their face. It'll change folks from a more square-shaped face to a more oval or heart-shaped face. So it's really been popular in our Asian patients who tend to have heavier masseters, and it helps to kind of rebalance their masseters in relationship to their face. Is there any longer lasting treatments relative to Botox? No, there's not been anything that I've found that works longer than the 3 to 4 months. I do have a couple of patients anecdotally who come in every 6 months. For some reason, it does seem to last longer in them. I've not been able to identify why that's the case, and there's no studies that support that. But anecdotally, I've had patients, they come in every 6 months. I have one patient who comes in just once a year for her masseter injections for Botox. And we've found that is her timeline. So, typically though, I see 3 months is the interval for Botox treatments.
Do you have any information or any slides on the hydrofacial? A couple people are curious and interested.
So just to talk about the hydrofacial, I don't have slides on it, but if you check out our website, if you go to acscosmetic.com or agnihotricosmeticsurgery.com, there's information on the hydrofacial. You can take a questionnaire, and it can help identify you in terms of what type of hydrofacial candidate you are. We have several different levels of treatment. Now, it's all non-surgical. It's non-invasive. It's not a laser. It's not a peel. It's not microneedling. What it does is it's a patented exfoliating treatment that helps to open and clean pores. It removes dead skin cells. It helps to rejuvenate and enhance the skin. They say you can do it as often as once a month. And we have a huge number of patients who come in once a month for their hydrofacial treatments. It's great to do just before an event. So if you have a wedding or if you have a party to go to, literally people will come in on Friday morning. They'll be ready to go out Friday night. And it just helps to make the skin feel firm and tight, and it feels fresh and smooth, and it helps to clear out all the dead skin cells. You know, if you're just getting back from the beach and you're peeled and dry and flaky, it just helps to kind of get rid of all that stuff in one 30 to 45 minute session. And it works so well. It works great with combined treatment. So sometimes folks will come in, they'll do a hydrofacial, then we'll do a little Botox, and they are ready to rock and roll for the weekend.
Sounds like a great thing to do after a good couple months of social distancing.
Absolutely. And it's aerosol generating, which is the best part. So we're ready to do it when we get the all clear here.
Perfect. Dr. Schleider wants to know, or he kind of made a comment, the Botox is to break up the muscle memory pattern after the series of 3 injections. Is that not correct? So I think what he's possibly implying is that maybe after a series of 3 sets of Botox injections, that perhaps the patient may not need it as frequently.
That's exactly right. So what it'll do is it'll help to kind of rebalance the muscle fibers, the muscles atrophy slightly, not to the point where you can't chew or talk or function, but enough to be able to help with pain, help to rebalance those fibers to be able to function